Welcome to this video series. The informed patient is the key to treatment success. So here we are trying to improve the knowledge level of patients regarding different diseases and disorders. Today we are dealing with the rheumatoid arthritis. It is quite common in the sense there are millions of those who are suffering from rheumatoid arthritis. Yet, it remains misunderstood by the majority. Whether you are battling this condition or whether you are looking after someone with rheumatoid arthritis or whether you are in initial diagnostic stage of it or whether it has been with you for quite some time, it is always better to have a good picture about what is behind this disease and what are the possibilities so that you take better decisions regarding your health. This program on rheumatoid arthritis has been divided into 4 different sections. Why this has been done is to make it easier for someone who is interested in a particular aspect of rheumatoid arthritis to go directly to that section, or if they would like to have a fuller picture, they could go through this series, this 4-part series, to get a reasonably total picture on what are their options and how to make better decisions. The first part, we explore the nature of rheumatoid arthritis, including its causes, symptoms, and what happens in the body when this disease develops. We also look at what predisposes certain people to rheumatoid arthritis and also what are the ways in which a confirmative diagnosis is possible. At the end of this segment, we will have a better idea regarding the foundation of this disease. To begin with, the first question to Dr. Jolie Thomson is, what is rheumatoid arthritis and how is it different from other types of arthritis?
Rheumatoid arthritis is basically an autoimmune disease. Autoimmune disease means our own immune system is attacking our own joints actually. So there are around 650 muscles and 250 joints are there in the body, and any of the joints can get affected. But usually, or the rheumatoid arthritis, hands, small joints on the hands, or even the leg, knee, any joint can be get affected. The other arthritis, especially the most common is osteoarthritis. In that, it is different. The part affected is actually different. For the osteoarthritis, the cartilage is getting affected more actually. In this rheumatoid arthritis, the joint capsule and the cartilage and even the bone is getting affected. Any part of the joint can be get affected. So, if there are other arthritis like psoriatic arthritis, so many type of arthritis are there.
In rheumatoid arthritis, everyone initially is worried when there is joint pain, whether it is because of this rheumatoid arthritis. So, what are the early symptoms of rheumatoid arthritis?
So for any arthritis, if it is rheumatoid arthritis or any other arthritis, the main problem, when we doubt about an arthritis, it is because of the pain on the joint or stiffness. So if you feel pain on the joint, you may think it is an arthritis. So it is arthritis because there is an inflammation. Arthritis means inflammation of a joint. If it is on the hand, it is that joint is affected, or if it is knee, we call it as arthritis of the knee. So if a patient get a knee pain or a joint pain anywhere, It can be of different type, and whether we'll usually a doctor will diagnose, whether we'll see the inflammatory markers, and also for the rheumatoid arthritis there are autoimmune markers are there, autoimmune antibodies are there. So it depends on the symptoms. We do the test and find out which category of the arthritis is belong.
Actually, when rheumatoid arthritis is diagnosed, the early symptoms, as you said, are joint pains. Actually, what makes these joints painful, and also simultaneously their movement also gets restricted. People find it difficult to move fingers or move their joints. What is the reason this stiffness happens and this pain develops?
If you have developed pain, that means there is an inflammation. That means your immune system is active and it is tried to defend you. It defend some pathogen. It can be a virus or bacteria or a toxic element. Some toxins can be there. In the rheumatoid arthritis, also the same thing is happening. Yeah, if it is a septic arthritis, that is means the bacteria is there. It is called as usually septic arthritis. In rheumatoid arthritis, an autoimmune disease where the body finds it, the immune system of our body finds the cells covering that taking part in the joint capsule or the joint tendon or bone is actually, they consider it is actually a foreign body or it is a damaged cell. Then there is some certain chemical stimulus are coming. That is, our immune system is activated to take away or destroy that damaged cell. That is actually happening. Because of that, you feel the pain. That is because of the inflammatory cascade. There is a change. So many chemical changes he has happening inside the, especially our white blood cells and this and some messengers, and then the pain starts. And it is actually a warning from the body, this pain, and even the redness and swelling, that there can be edema. So all these are the signs of inflammation. Through that, the body is giving a warning. So we had to find out what is actually creating. Actually, in the rheumatoid arthritis, it is there is no pathogen, there is no bacteria in that involved. So you cannot treat with antibiotics. So the first line of management is painkillers. When this the stiffness happens because of the pain, naturally the body's automatic mechanism is to keep it not moving. Because if the movement is there, pain. So body keeps it. So the stiffness also come. And if you are continuously not moving the joint, then this deformity, that is fixity, will be permanent. That is otherwise only partial or some. If you not move for 1 or 2 days, you will be able to move it after a few days. But if it is a pain, it is continuing and you are not moving it for weeks or months, that the joint can get fixed.
So actually, this joint pain comes because of the body's immune activity, which creates inflammation, and that inflammation is actually creating that pain in the initial stages. And also the stiffness is because moving creates pain, so the body tries to remain immobile, body joints and all. Okay. Is rheumatoid arthritis hereditary? Because generally people who are having parents who have had rheumatoid arthritis or having members of their family having this, they have an extra fear that they can get it more than normal.
Yes, definitely. That if the one of the family member, father or mother or sister is affected, there is definitely a chance of the chance will be higher for the person. But it need not be there. That means there is some hereditary factors are there. Now we have even one test is there, HLA-B27. HLA-B27, if it is positive, there is a chance for getting the disease. But in the rheumatoid arthritis, it's not only the genetics, but the epigenetic factors also play a major role. That is, even if your father and even both of the person, if the father and mother is affected, then definitely the chance will be high. But definitely, if you control your lifestyle, there is definitely the chance of getting the disease will be much lower, because the epigenetic factors are controlled by the lifestyle factors. So that is, even if you don't have to worry if you have a family member or there is a family thing. Only thing you should take care that make sure that you lead a healthy lifestyle, and so you can prevent the disease.
In the case of rheumatoid arthritis, there is a feeling that certain types of people, not only because of hereditary reasons, but for other reasons also, certain people who have certain parameters have more risk of developing rheumatoid arthritis. Is it true?
Yes, definitely. If you are overweight, for example, if the person is overweight, the chance of you getting a rheumatoid arthritis is high. And if you have any other autoimmune disease like thyroiditis, it is very common in part of the country. It is so common that Hashimoto's thyroiditis. So if the patient may be getting first the Hashimoto thyroiditis. There are so many people who's getting the Hashimoto thyroiditis very young age. Maybe in the teens itself they get Hashimoto thyroiditis. So they will be continuing with this hormone therapy, that is replacement. Levothyroxine will be taking, and the thyroid function will be okay. But the autoimmune process of destroying the thyroid gland will be continuing. So after some time, maybe after 4 or 5 or 10 years, you may get the rheumatoid arthritis also. And this the patients who is having an autoimmune disease, that's getting a cancer also is high. This is very true with the this thyroid Hashimoto thyroiditis patients. The chance of getting thyroid cancer is high, and also many of the studies showing that even the thyroid, that is actually it is not because thyroid alone. When there is a autoimmune disease, that means your immune system is not working properly, so it is strained. So any other disease where you can get not only the cancer, you can get metabolic syndrome even because of the medication itself. This rheumatoid arthritis patient will be taking even this steroid medicines and all immunosuppressants to reduce the pain and stiffness and all. So that is again, actually it is suppressing the immune system, so it can increase the chance of getting infections and cancer. And also because of the steroids, the hypertension, diabetes, heart disease, cholesterol, all these things can be high also.
Normally, we hear that those who are having rheumatoid arthritis, they normally diagnose this situation slightly late. So what happens is initially they may be using some painkillers and other over-the-counter medications and all that. So what people generally understand is that delay causes some problems for recovery also. And what are the diagnostic tests that the patients or those who are having a doubt regarding this should be aware of to actually diagnose and confirm rheumatoid arthritis?
When a patient comes with the pain of the joint and symptoms of rheumatoid arthritis, the rheumatologist and also even the basic general physician can be able to understand whether it is rheumatoid simply by the symptoms itself, we can say. But for the confirmation, what we do is this, inflammatory factors. That's a simple test like a CBC, blood count, WBC count may be high, and ESR, and CRP and HSCRP. HSCRP is an indicator for whether that heart also is getting involved, that is blood vessels also getting involved. And again, more specific test is actually this autoimmune antibodies. Autoimmune antibodies, this RF factor, and also anti-CCP. It is very usually these two are the most common for this rheumatoid arthritis patient increasing initially. And also for the differential diagnosis, this ANA test also is very important. That is anti-nuclear antibody. That is also another autoimmune antibody testing itself. If the ANA is positive, that it is maybe it is not only the joints is getting affected, other systems also getting affected. It can be because of the SLE, that is systemic lupus erythematosus. And in otherwise also, from my experience, and we usually routinely do this antimicrosomal antibodies or this TPO, that is thyroid peroxidase antibody, because it is very common, both is coexisting, that is thyroid Hashimoto thyroiditis and the rheumatoid arthritis. So many of the patients, even if the thyroid function is normal, also that TPO or AMA or can be high also. So the diagnostic test is actually for the diagnosing whether it is rheumatoid arthritis, and also to exclude other things, and also to we have to investigate how much is the extent or whether any other system is getting affected. For that, thyroid function and even the renal kidney function, liver function, it's very common that rheumatoid arthritis patient is getting affected by the other organs affected, even the liver. Autoimmune hepatitis is very common with the rheumatoid arthritis, and even the liver function can be affected because of the medicines we are taking also. So overall, we had to see the other system, whether it is affected by the disease or because of the medication also. So there are other type, even if this rheumatoid arthritis and anti-CCP and all is negative also, there is another sort of seronegative arthritis is there. That is also rheumatoid. Only thing, there are so many autoimmune factors can be affecting. We have only very few tests available. Many after in the future we may get more and more autoimmune antibody testing will be getting available, and so we'll be able to find out or specifically which autoimmune antibody or the receptor is getting involved. But currently, if it is negative also, if the autoimmune antibodies we are checking is negative also, we cannot rule out autoimmune or rheumatoid arthritis. But it is always good to have when we can assess the progress of the disease and the treatment, how much improvement is coming because of the treatment also.
This brings us to the end of this foundational segment, where we try to understand what is rheumatoid arthritis, what are the early symptoms of rheumatoid arthritis, why do patients with rheumatoid arthritis experience joint pain and stiffness, and what are the hereditary aspects of rheumatoid arthritis, and who has more chance of developing it, and also what are the diagnostic tests that are currently available, which go to a large extent in helping diagnose and confirm rheumatoid arthritis. But at the same time, we have also understood rheumatoid arthritis is a very complex disease condition, and understanding it is the first step to treating it in the right way. And in the next part, in the next segment, we will now focus on what are the latest and current treatment methods available, including some surgical options as well. Thank you.